According to the Merriam-Webster Dictionary, to integrate means to form, coordinate, or blend into a functioning or unified whole. But for a CPT, having an integrated approach is more than just words on a page. It's a set of principles that gives you the flexibility to pick and choose the right set of exercises for each individual's needs. It's a tailored, create-your-own adventure of sorts, with the goal of maximizing your client's results. Integrated training is a concept that combines flexibility, cardiorespiratory, core, balance, plyometric, speed, agility, quickness, and resistance training into one system. It's an all-inclusive approach to exercise that can lead to improvements in overall health, wellness, and athletic performance. When fitness professionals take an integrated approach to exercise, their programs are well-balanced boredom reducers that maximize results. It's also a great way to switch things up. For instance, if you have a client who was recently released from physical therapy due to a knee injury, you can switch out the heavy squats for core and balance drills to make that training session work better for them. Using integrated training principles, you can discover new and exciting exercises, movements, and other variables to add to your professional toolbox. And with that knowledge, you'll be able to create customized exercise programs that provide a ton of benefits for your clients. There will be psychological benefits such as stress relief, improved mood and improved sleep, physiological benefits such as improved cardiovascular, respiratory, and endocrine function, body composition benefits such as fat loss and increased lean muscle mass, and performance benefits such as increased flexibility, endurance, strength, and power. As they say, variety is the spice of life. A fitness professional can really benefit from implementing integrated training with their clients because of the variety of exercises involved. Programs that integrate different types of training in a multiplanar fashion have shown to be more optimal than isolated resistance training programs. Areas of improvement were found in movement quality, speed and agility, strength, endurance, flexibility, and power. This doesn't mean that isolated training is ineffective, but if you really want to provide the greatest changes to clients, integrated training improves more variables than isolated training. Now, integrated training isn't just a variety of exercises. Additional principles include training in a systematic and progressive fashion, training fundamental movement patterns, training with optimum posture, training for optimum range of motion, training in all planes in motion, manipulating acute variables, and designing exercise programs based on assessment results. I know that's a lot, but we'll go over it all. Starting with systematic progressive training. Think of it like this. When a house is built, construction companies use a systematic and progressive approach to ensure its solidity and stability, starting with the foundation. The outcome would be vastly different if a house was built directly on the ground versus a concrete slab foundation. For example, the walls and roof may become uneven or unstable, reducing the overall integrity of the house. The same is true for exercise. Like a house, the body needs a solid foundation of fitness before embarking on an intense training regimen. It is illogical and potentially dangerous to do exercises that are too advanced or physically demanding. It can also cause frustration and reduce a client's own self-efficacy. It will be your job to make sure your clients build a solid foundation first. That includes appropriate levels of aerobic and muscular endurance, joint mobility and stability, and core strength. The best way to do this? Bingo! A systematic and progressive program design. Using a progressive overload approach, the body sufficiently adapts to the new demands placed on it and consequently becomes stronger and more resilient. On the other hand, skipping steps can do more harm than good. It can increase risk and client frustration, delay goals, and result in inconsistent exercise programming. Progressive overload is only possible with consistency. See where I'm going with this? Let's keep going. Fundamental movement patterns are a necessity for all fitness professionals to demonstrate and teach to their clients. And not only should you be able to incorporate diverse movement patterns into your clients' programs, you have to master these movements for their own benefit. When you're instructing a client, CPTs have to be able to explain, demonstrate, correct, and cue. Plus, you'll gain more street cred with your clients if you prove you can walk your talk. Most exercises involve at least one of these movement patterns, though more movement patterns exist, and many of these patterns can be combined into a single exercise. You've got squatting, hip hinges, pulling motions, pushing motions, and vertical pressing. Categorizing exercises according to movement patterns is a good method for designing exercise programs. Historically, resistance training programs were developed and implemented according to isolated body part training. This is especially true when it comes to bodybuilding. So maybe you do chest and triceps on Monday, back and biceps on Tuesday, legs on Wednesday, and shoulders and arms on Thursday. While isolated body part training is still an effective method for increasing muscular hypertrophy, designing exercise programs based on movement patterns can provide enhanced adaptations when compared to isolated resistance training, such as enhancing coordination and athleticism. And the really cool thing is there are almost limitless possibilities to the combinations of movement patterns. Okay, on to posture. Generally speaking, posture is the way the body maintains spinal position in relationship to other body segments, and that's important. Maintaining ideal posture places the client's body in the most optimal state to perform movement patterns safely and effectively. Ideal posture can be a difficult challenge, especially as people age and have developed movement patterns that compensate for weaknesses and faulty static postures. However, with the progressive and systematic exercise program, you inherently maintain or correct posture as you go to reduce injury risk, enhance the client's physical health, and allow for a more enjoyable exercise experience. Programming for optimum posture is going to involve using appropriate flexibility and strengthening techniques to help correct muscle imbalances and include unilateral, bilateral, anterior, and posterior exercises to create symmetry between right and left, as well as front and back sides of the body. Improving posture will be limited if you don't tackle those muscle imbalances. The recipe for success includes flexibility, core, balance, plyometric, and resistance training exercises. Cardiorespiratory exercise may also be helpful due to changes in body composition and improvements in muscular endurance. Like posture, working within an optimal range of motion allows joints to move freely. Clients are often plagued by muscle imbalance, poor posture, or joint restrictions. As a consequence, range of motion at certain joints can become restricted, which limits movement and may lead to injury. On the other hand, complete range of motion means the body isn't limited or restricted. In other words, it's the ability of a joint to move freely between the open and closed portion of the joint movement. You'll need to be able to understand where prior injuries may have caused scar tissue to form, which changes the mechanics of the joint. Ultimately, some people may have to work within specific constraints and use caution to avoid causing further injury to that area. Training for optimum range of motion requires patience by both the client and fitness professional because a lot of factors come into play when you're dealing with the appropriate range for every person. Fitness professionals should develop exercise programs to require movements in all three planes of motion: sagittal, frontal, and transverse. Developing exercise programs that overly emphasize the sagittal plane of motion and neglect exercises in the frontal and transverse planes is a common mistake. You'll get way better muscle recruitment if you balance work between all three planes. In addition, many injuries occur in the frontal and transverse planes of motion. Unfortunately, when a client doesn't train in all three planes of motion, it's limiting that client's body to move efficiently, diminishing ideal movement and athleticism. So, selection of a variety of exercises in all planes of motion is a critical component of any training program. Acute variables, also known as exercise training variables, determine the amount of stress placed on the body and ultimately the physical adaptations that occur, like increased strength, endurance, weight loss, or muscle gain. Think of acute variables as all the building blocks that are used to design an exercise program, including repetitions, sets, training intensity, repetition tempo, rest intervals, and so on. It should go without saying, but I'm going to say it anyway. Programming should focus on the assessments done prior to the client's initial workout. Appropriately conducted assessments are critical to developing a baseline value for different exercises. Also, during the assessment, you'll uncover muscle imbalances, postural abnormalities, and other health concerns. With these in consideration, you can then develop the proper movement patterns for your client's new exercise program. It may sound easy, but gathering data from the assessment and accurately using it to design exercise programs can be quite the task. But this process separates generic physical activity from systematic and progressive exercise programs. This is important because a lack of assessment shows lack of thought and programs that aren't really programs at all, just stuff thrown together. After your baseline starting point, you should also schedule reassessments to keep your clients' goals and motivation top of mind and at a high level. So do the work, all the research, and then create an exercise program that isn't just exercises, but something that becomes an integral part of your client's overall health story.
Here we are, the final phase of the OPT model. That's right, we've powered through to talk about power. The power level is at the top of the OPT model and includes just one phase. Phase 5, power training. Power training isn't necessarily a common practice in the fitness environment, but it does have a viable place in a properly planned training program. Power training is specifically designed to increase the speed of muscle contraction. It uses the adaptations of stabilization and strength acquired in previous phases of training and applies them at speeds that the body will regularly encounter in everyday life and sports. The workout template for Phase 5 is the same as other phases in the OPT model, but the training variables and exercise selections are specific for enhancing muscular power. As a quick recap, the template includes multiple sections: warm-up, activation, skill development, resistance training, client's choice, and cool down. Let's start with the warm-up. The flexibility techniques used in Phase 5 include self-myofascial techniques and dynamic stretching. A Phase 5 flexibility routine doesn't typically involve static or active stretching, but if your client displays a limited mobility or muscle imbalances, static or active stretching can be included prior to them performing dynamic stretching. Cardiorespiratory exercise isn't needed during a Phase 5 warm-up because dynamic stretching adequately prepares tissues for the upcoming demands of the workout. Next, just like the stabilization and strength levels, the activation techniques for Phase 5 include core and balance exercises. However, core and balance exercises are optional during this phase because similar movement happens in the resistance training. If you opt in, we're looking for more explosive core and balance exercises that are designed to increase rate of force production through a full range of motion. Similar to previous phases, the skill development section is reserved for either plyometric and SAQ exercises, or alternative forms of exercise. It'll depend on the goals of your client and your own expertise as a fitness professional. But Plyometric and SAQ exercises are also optional activities because power-based movements will be a focus during the resistance training portion of the workout. If chosen, the plyometric training and SAQ exercises should be performed as explosively as possible. Now we get to the all-important resistance training section of the workout. Here we focus on high force and velocity to increase our client's power output. This is accomplished by supersetting a strength-focused exercise with a power-focused exercise for each body part. For example, it could be a heavy barbell bench press superset with an explosive medicine ball chest pass. The first exercise uses a heavy load and involves a rep range of 1 to 5. The second exercise in the superset involves explosive movements with light loads for 8 to 10 repetitions. Your client will perform a total of 3 to 5 sets. This style of training increases your client's abilities to produce force and velocity, both of which are needed to improve power. And then, client's choice? Yep, as always, keep it safe and fun. Your client can choose 1 to 2 of their favorite exercises here. So we've reached the final component of the final phase, the cool down, which follows the same protocols as the previous phases. But saying the final component of the final phase is sort of misleading. A client doesn't just reach the top of the OPT model and that's it. You'll circle them back through previous phases for recovery and any number of other reasons. The OPT model is a great tool and one part of a journey of fitness that'll always be dynamic and flexible based on your client's needs. So, power on. The Optimum Performance Training Model, or OPT for short, was designed by NASM to organize exercise routines in a safe, systematic, and progressive fashion. It's an evidence-based model that simultaneously improves all physical abilities through its leveled approach. Right now, we're going to take a look at Phase 1, Stabilization Endurance Training. When it comes to building just about anything, having a stable foundation's the key. An exercise program is no different. This is the focus of a Phase 1 program. But before discussing Phase 1 in more detail, let's start with the OPT model as a whole. This will help give us some context. The OPT model simplifies traditional periodized exercise models into 3 distinct levels: stabilization, strength, and power. Then, it goes a step further by subdividing those 3 levels into 5 unique phases of training. It's like a staircase, guiding clients through different levels of physical adaptation. You'll guide your clients up and down the stairs, stopping at different steps and moving to various heights, depending on their goals, needs, and abilities. It's important to note that the OPT model uses a specific workout template to organize daily exercise routines. Regardless of the phase you're using, the template is always the same. The only differences are the acute variables and the exercises selected. We'll look at each of these in more detail shortly. But first, we're here at Phase 1, which is in many ways the most important phase. So, what exactly are we trying to achieve in stabilization endurance phase? Well, it focuses on 2 main adaptations: the development of proper movement patterns and mobility and stability of the entire kinetic chain. Getting this right prepares the body for the demands of higher levels of training that follow. In this phase of training, you'll help your clients learn basic exercise skills and get comfortable with the proper use of equipment. That kind of confidence can lead to adherence to the program and minimize the risk of injury moving forward. This phase is also the time to correct muscular imbalances, postural control, and improve muscular and cardiorespiratory endurance. This is a level that you'll cycle back to periodically, so truly, it's the foundation of the entire model. There are also basic movement patterns associated with this phase, including squats, hip hinges, pulling motions, pushing motions, vertical pressing, and multi-planar movements. It's amazing to think how integral these movements are, not just in the realm of exercise, but in everyday life. and it's another reason to push for success in the stabilization endurance phase. Let's return now to our template and see how each part's treated in the stabilization endurance phase. Keep in mind that you don't have to include every part into your client's workout, especially when limited time is a factor. It'll be up to you to decide what's most important based on your client's goals, needs, and abilities. First up, the warm-up, which uses a variety of flexibility techniques. The first two techniques in this phase include self-myofascial techniques, like foam rolling, and static stretching. You can also include dynamic stretching, but it's optional. A quick 5 to 10 minute cardio warm-up is also optional after your client has finished stretching. It's especially important to focus on stretching muscles that were determined overactive during the assessment process. In other words, perform movement assessments like the overhead squat test to identify your client's overactive muscles. Next up, activation. The activation techniques for this phase primarily includes core and balance exercises. It's important to choose core exercises that emphasize stabilization and intervertebral stability to target local core muscles. These exercises should focus on isometric contractions or use slow repetition tempos that involve little motion of the spine. Examples include planks, bridges, cobras, and many more. The volume and intensity of core exercises should be relatively low because the goal is to activate, not exhaust those core muscles before introducing more intense exercises later in the workout. Similarly, balance exercises must be systematic and progressive. These exercises should initially involve little joint motion of the balanced leg. In other words, the stance leg remains relatively motionless. These are entry-level balance exercises designed to improve stability of the ankles, knees, and hips. Example balance exercises appropriate for phase 1 include a single leg balance, single leg balance reach, single leg lift and chop, and many more. So now we come to skill development. During the skill development section, you can either program plyometric and SAQ exercises or teach your client basic movement patterns and how to use exercise equipment. It's up to you, depending on the skill and fitness level of your client. Just make sure that all exercises are performed with precise technique to minimize the risk of injury. If you program plyometric exercises, these exercises should be relatively low intensity and focus on optimal landing mechanics. To do this, instruct your client to hold their landing position for 3 to 5 seconds and fix their posture before they execute another jump. This will prepare them for higher intensity plyometric drills later on. On to resistance training. These exercises should focus on improving movement patterns and strengthening specific muscle groups. The goal of resistance training in this phase is to prepare muscles, tendons, ligaments, and joints for higher loads used later in the OPT model. Resistance training also promotes ideal joint stability, muscular endurance, and neuromuscular efficiency, which is a fancy word for coordinated movement. You'll do this by using resistance training exercises performed in a controlled yet progressively unstable environment. It's important that your client master basic movement patterns before progressing their exercises to be more unstable. For example, your client may need to begin with exercises in a seated position before progressing to standing or even single leg variations. The amount of instability that you introduce should always be specific to your client's capabilities. Acute variables include performing 1 to 3 sets of 12 to 20 repetitions with a slow repetition tempo for each exercise. Client's choice is exactly what it sounds like. Letting your client choose their own exercises is a unique and fun characteristic of their exercise program. The goal is to develop client adherence and self-efficacy. In this workout section, encourage your clients to choose 1 to 2 of their favorite exercises while you monitor their form and technique. And finally, the cool down. This should include optional cardio work, self-myofascial techniques, and static stretching, in that order. Phase 1 stabilization endurance training is gonna set the stage for your entire fitness journey with each client. Moving through the OPT model will help your clients prepare physically and mentally for the challenges ahead. And it's a great time to continue building trust and camaraderie together. In many ways, it's the most exciting and fulfilling phase of the OPT model. So enjoy the ride and make sure you get it right before moving on to the next phase.
It's great to get out and get moving, isn't it? Getting those muscles all warm and loose. You know, I was thinking about something on my run about how in our bodies we've got the movers and shakers, and the muscles are the movers. Muscles provide our human bodies with a variety of functions, and that allows for the manipulation of forces placed on the body to either produce, stabilize, or resist movement. While we move, each muscle is an agonist, synergist, stabilizer, or antagonist, depending on the joint motion that's happening at the moment. Let's look closer at each. Agonists are muscles that act as the prime movers for a joint motion. So basically, they're the muscles with the most responsibility for generating the primary forces for a particular movement. Here are some examples. The gluteus maximus is the agonist for hip extension. The quadriceps are the agonists for knee extension. The anterior deltoid is the agonist for shoulder flexion. The biceps brachii is the agonist for elbow flexion. And the triceps brachii is the agonist for elbow extension. Now, synergist muscles are kind of the buddy system muscles to agonists. They create forces to assist prime movers, but aren't the primary force producer for that joint motion. Examples of this include the hamstring complex. The hamstrings are synergistic with the gluteus maximus when performing hip extension, such as when performing a squat. Additional examples include the triceps brachii assisting the pectoral muscles during a chest press, and the biceps brachii assisting the latissimus dorsi during a pull-up. While the prime movers and synergists are doing their thing, moving through the full spectrum of a movement, the stabilizer muscles are also there, contracting isometrically to support the joints. We can see this action in the transversus abdominis, a deep abdominal muscle that stabilizes the spine during compound movements, like a squat or overhead press. Another, maybe simpler example are the rotator cuff muscles, which stabilize the shoulder during upper extremity movements, like a push-up. Here's a fun fact about stabilization. Some muscles have the ability to stabilize a joint by contracting automatically in anticipation of movement. This is referred to as feed-forward activation. And just another example of how cool the body is. Lastly, antagonist muscles, just as you might expect from the name, perform the opposite action of the prime mover. For example, the biceps brachii, which is an elbow flexor, is an antagonist to the triceps brachii during elbow extension. And this applies in reverse as well. During elbow flexion, the triceps become the antagonist to the biceps. You can also apply this to how the hip flexor complex is antagonistic to the gluteus maximus during hip extension, while the gluteus maximus is antagonistic to the hip flexor complex during hip flexion. I've got one more for you if you feel like stretching your knowledge a little bit. And hey, we've come this far, so why not? Muscles can even take on different roles depending on the joint motion being performed. The infraspinatus muscle of the rotator cuff is particularly impressive in its versatility. It takes on the role of an agonist for shoulder external rotation, a synergist when abducting the shoulder to reach overhead, and a stabilizer during other joint motions of the shoulder. How about that, right? I'm consistently impressed with the body's ability to move through all of the internal muscle work that makes everything happen, sometimes even automatically without us even thinking about it. Bodies are cool. And right now, I'm gonna keep moving this one.
Some people are yoga people. Some are strength training folks. And others are runners. We can all get stuck in our little bubble, and sometimes you need someone to help you figure out how to shake things up, put a new spin on old routines. Variety is the spice of life, right? Well, as a CPT, you can be that spicy someone for your clients. Integrated training combines different forms of exercises into one program. These forms of training include flexibility, cardio, core, balance, plyometric, speed, agility, quickness, and resistance training. Your clients might already be familiar with these exercises, but not necessarily when used in a systematic fashion. You can dazzle them with this integrated training approach, and in turn, it can have a profound impact on their health, fitness, and athletic performance. This approach is ever-changing and gives you a system with a progressive framework, but only if the training is implemented correctly. And how do you implement that system correctly? I thought you'd never ask. Let's start with flexibility. Flexibility training involves different types of stretching techniques to improve tissue extensibility. Now, this allows the body to move more freely. NASM recommends using a variety of stretching techniques like self-myofascial techniques, static stretching, active stretching, and dynamic stretching. And many benefits come from increasing flexibility, like increased joint range of motion, possible decrease in muscle soreness, and even a potential to reduce the risk of injury. Next up, cardio. Okay. So the number one cause of death around the world is heart disease. I know, way to be a bummer. But there are many things we can do to combat this issue. Cardio training is a cornerstone of improvement for heart and lung functionality. Cardio training can improve the capacity and respiratory and cardiovascular systems to provide muscles with oxygen during sustained or intense exercise. Typical forms of cardiorespiratory exercise include walking, jogging, running, cycling, biking, swimming, and rowing. In fact, a lot of competitive sports give you some good cardio. In most cases, it's a critical component of an integrated training program. However, the mode, duration, and intensity of cardiorespiratory exercise will be dependent on your client's health and performance goals. There are many benefits to cardio training to help avoid the dire stuff I mentioned earlier, including decreased resting heart rate and blood pressure, and increased stroke volume and cardiac output, to name a few. Core strength is very important. Your core muscles are those of the trunk and pelvis that are responsible for spinal and pelvic stability. These muscles also generate and transfer energy from the core to the extremities. Exercises aimed at enhancing the functionality of the core musculature are considered part of core training. Many movements can be completed using a variety of exercises that work all three different planes of motion, as well as many muscle groups, including the obliques, low back, and gluteal complex. Would you like to hear the benefits of core training? Of course you would. It enhances posture and spinal health, improves movement and coordination, helps minimize low back pain, and increases trunk rotational power needed to sports like golf or tennis. Balance is the ability of a person to maintain, achieve, or restore a specific state of balance without falling. Balance training is a method that can create better movement patterns. Balance training is used for improving postural control by challenging the alignment of the body's center of gravity with regard to the base of support. The more control the body is able to maintain, the more opportunities abound to incorporate more challenging movements into your exercise sessions. This is true for clients of any age, especially elderly clients, though there are benefits for people at any age and level of athleticism. Balance training helps reduce the risk of falls and decreases the occurrence of ankle sprains, improves body awareness and control, and can strengthen the hip musculature and lower extremities. Now for something less typical, plyometric training. Plyometric training is also known as reactive or jump training. I know, a lot of people might think that plyometric exercises are only for serious athletes. However, it's a form of exercise that can be safe and effective for many populations. It's all about the expression of muscular power. Variations of plyometric training exist to accommodate clients of all different skill and fitness levels. Plyometric training has some interesting benefits, including increased bone mineral density, decreased risk of bone and joint injuries, improved soft tissue strength, increased metabolic expenditure for improved weight management, and improved performance for athletes of all levels. Speed, agility, and quickness. We call it SAQ. SAQ training is another form of exercise that can be misconstrued as something fit just for athletic purposes. Like plyometrics, these drills can all be modified to be beneficial for all types of clients. SAQ training is a system of progressive exercises and instruction to enhance the capability of individuals to be more skillful at faster speeds and with greater precision. The movement patterns used can also help in preventing falls and increasing agility, reaction time, sprinting velocity, and lower body power. SAQ training is similar to plyometric training, but the idea is to propel the body as quickly as possible, to accelerate and decelerate as fast as possible, or to change directions with ease. And finally, resistance training. You shouldn't try to resist resistance training because it can promote marked increases in muscle strength and hypertrophy, with improvements in these areas for folks at every age and of every gender, and who doesn't want that? In addition, resistance training has shown to be an effective mode of exercise to improve bone density, muscular strength, and enhancing cardiovascular health. It also plays a fundamental role in improving athletic performance and rehabilitation from injury. Resistance exercise is an effective method for increasing lean body mass and reducing body fat, especially when it's combined with proper dietary measures. You have to be well versed in the benefits of resistance training because it's a big part of being a CPT and putting exercise programs together. And just like all of the other areas of integrated training, resistance training is going to help decrease the risk of injury because all of those soft tissues, ligaments, tendons, cartilage, and muscle fibers will be super strong from all the hard work. So, keep it interesting, mix it up, make it a little spicy. But most importantly, follow a systematic, progressive plan that incorporates all of the areas we've just covered.